Virtual Fracture Clinic. Distal Radius Fracture.
Hi, I'm Tom Tressida, an orthopaedic consultant at the Royal Melbourne Hospital. At the Royal Melbourne Hospital, the Virtual Fracture Clinic is run by specialist orthopaedic consultants and advanced practice physiotherapists. In many cases, we can review your injury and provide care without you needing to come back into the hospital. This video will give you the information you need to manage your recovery. The distal radius fracture, or broken wrist, is the most common fracture in the arm. It's often caused by a fall onto the outstretched hand. You can expect to feel pain and may see swelling, redness, and sometimes bruising. When your wrist is examined, there will likely be a point of maximal tenderness over the fracture site. On an X-ray, the fracture looks like a black line or crack in the bone. If the fracture is in a good position, it will heal if supported in a cast and without the need for an operation.
Treatment.
The most common treatment is to support the wrist in a cast for 5 weeks to limit the movement in the area while the fracture heals. The cast will be worn at all times. It is important not to bear weight through the injured arm. This means no lifting, carrying, pushing or pulling for 6 weeks. Objects up to 250 grams, like a can of drink or a mobile phone, are okay, as long as it doesn't cause discomfort. Use your pain as a guide to how much you can use the arm in the first weeks of your recovery. It is not harmful to move your arm, though there may be some discomfort. Feeling very sore is a sign that you should rest more. Follow the exercises in the brochure to reduce the risk of complications like stiff fingers. This fracture is expected to heal in 6 weeks. If you're a smoker, this can slow healing time, so we advise that you cut down or quit. You will have an appointment after 1 week to change your temporary cast to a lightweight, more protective one after your swelling has reduced. You will often need an X-ray to check the position at this time. X-rays are checked virtually, so you will not have to wait to see a doctor on the day. There will be another appointment after 5 weeks to remove your cast. If after 3 months you still have pain or problems using the wrist, contact the Virtual Fracture Clinic or visit your GP.
Can I drive?
You should not drive for at least 6 weeks until you are out of the cast and can grip the steering wheel firmly.
When can I go back to work?
Getting back to work will depend on the job that you do. A desk worker may return in a few days. Someone who has a very physical job may need 6 or more weeks off. Speak to your doctor if you need a medical certificate.
Can I stay active?
You can return to playing sports or the gym after 8 weeks. You should have near full range of motion back in the wrist, at least 85% of your strength, and little, if any, pain. A physiotherapist can help you with a return to sport exercise program. Start with the exercises in this video.
Care at home.
Hi, I'm Emily and I'm a physiotherapist at the Royal Melbourne Hospital. We're going to talk about cast care and some exercises to help your recovery. The cast will be on for 5 weeks. Use a damp cloth or wipe to clean your fingers without getting the cast wet. To keep the cast dry in the shower, wrap in a thick plastic bag and secure with tape. You may need to ask someone to help you. If the cast does get wet, contact the Virtual Fracture Clinic. A wet cast could cause the skin to become damaged. Wrist injuries can be very sore. You should make sure to rest and use the arm less, especially in the first few days. Elevating the hand above the height of the shoulder can help, especially if the fingers are swollen. It is also advisable to use an ice pack or frozen peas over the area to help with swelling and pain. If you are putting the ice pack on the cast, make sure it does not get wet. Cooling the cast can also help with itching. Do this for 20 minutes, 2 to 4 times a day. Wrap your ice pack in a tea towel or cloth. Never place ice in direct contact with your skin. If your pain is not improved with rest and ice, you could try over-the-counter pain relief such as Panadol or Nurofen. If you are still very sore, consider an appointment with your GP to talk about other medications. After 2 or 3 days, start these simple exercises to help your recovery. You should do your exercises 4 times a day or more if comfortable.
Exercise 1. Finger range of motion.
Bend your fingers down like making a fist. Then open the hand out wide. You should be able to touch your fingertips to the cast after a few days. Repeat this 20 times.
Exercise 2. Elbow flexion and extension.
Bend and straighten the elbow. Repeat this about 10 times.
With her forearm in a cast, the model raises and lowers her arm. Exercise 3. Forearm rotation.
Keeping the elbow tucked into your side and bent to 90 degrees, rotate your palm over and back to feel a mild stretch. Repeat this about 10 times. When your cast is removed after 5 weeks, you will see a physiotherapist and start an exercise program to regain your movement. It is normal to take 6 to 12 weeks or more of exercises to regain movement in the wrist. If you have stiffness or weakness persisting after that time, it may help to see a physiotherapist. You can see your own physio locally or contact the Virtual Fracture Clinic to arrange a physio appointment at the hospital.
It's important that you understand these instructions. You're in charge of your own health. If you have any questions about your recovery, contact your GP or the Virtual Fracture Clinic.
The Royal Melbourne Hospital.